Hello everyone, and welcome to another episode of the Wise Decision Maker Show, where we help you make the wisest and most profitable decisions. My name is Dr. Gleb Tsipursky. I'm the CEO of Disaster Avoidance Experts, the future of work consultancy that sponsors the Wise Decision Maker Show. And today I want to talk with you about frontline health workers and how flexible remote work is providing a benefit for them. So this is a really important development. Now, in healthcare, frontline healthcare, and healthcare more broadly, but frontline healthcare especially, since most healthcare is delivered by frontline staff, there has been strong job growth, but stagnant wages. Unemployment rate is at an all-time near all-time lows, perhaps even all-time lows, very close to there. So frontline work like healthcare leads job growth. That is very, very clear. And the job market is very strong. But wage growth, which we have seen previously, has been cooling. So employers are offering many jobs, but they're hesitant to raise wages due to fears around recession and other such worries. There's still some fears around recession. And so flexible work has become a top benefit. Non-wage benefits like flexible work attract and retain workers. Very clear. It's quite cheap to offer, but incredibly desirable for workers. It is the most desired benefit after health insurance, according to a survey by Unum. And flexible work programs are really very helpful to improve retention, recruitment, productivity, and engagement. And we're seeing that impact even, you might be surprised, in frontline settings like hospitals, and perhaps especially so, where there's strong job, but perhaps a lack of willingness to raise wages to compete for workers. So let's talk a little bit about what healthcare workers are doing. You might think, how can frontline healthcare workers actually get remote work done? I mean, don't they need to be on the front line? They do. So we're not talking about full-time remote work, of course. We're talking about hybrid work. Now, what you need to understand is that healthcare workers spend a lot of their time, the plurality of their time, on non-patient tasks. So there was a study that recently came out in the Annals of Internal Medicine that shows that physicians spend only 20% of their time with patients. 49% of their time goes to various desk work. They're writing reports, emails, communications, ordering medications, doing various sorts of processing. That's 49%. Many even spend already 1 or 2 hours filing electronic health records after they get home from the workplace. So they're already doing some work from home. Now, most nurses, this is actually also surprising. We're talking about we're talking about physicians, but nurses, same findings. A study by Jackson Healthcare in Alpharetta, Georgia, found that nurses spend about 25% of their time in a 12-hour shift to direct patient care. So about the same amount of time as doctors. The majority of the remaining time is spent on various desk work, documentation tasks, such as logging patients into multiple systems, completing logs, checklists, paperwork, acquiring equipment, supplies, communication, all of that sort of stuff. So, remote work can provide real benefits for these frontline health workers. And this option applies to all of these healthcare workers, right? The doctors, the nurses. Remote work lets healthcare workers finish paperwork from home so they can save time and energy on commuting and administrative tasks. They just are not going to commute every day. They're just going to do a lot of their work from home. So the outcome is improved job satisfaction, reduced stress levels, high staff retention rates, and enhanced recruitment efforts. And of course, as part of that, improved well-being and reduced burnout. So let me tell you about a couple of hospitals with whom I've worked to figure out how to integrate flexible hybrid work with some of their frontline staff spending some days working from home into those hospitals. So they transitioned to remote work, meaning again, remote work some of the time, hybrid work, flexible work. They allowed some time of remote work for doctors and nurses to complete paperwork and desk tasks from home and conduct telehealth visits remotely. So providing telehealth visits to their patients, so monitoring and so on. So they adjusted schedules and they trusted staff to complete tasks from home. Of course, we set up a system for monitoring, accountability, and so on. And there were appropriate privacy protections set up for home offices which of course, realistically, doctors were already doing some work from home prior to this transition. So there was already some best practices that were set up. So it wasn't really hard to ensure HIPAA and various other privacy concerns. So what are the key findings from this hospital remote work transition? And again, this is not full-time remote work. This is some time of these frontline staff working remotely, so hybrid modality. The result was really outstanding. They quickly became employers of choice in their respective areas for healthcare staff, and they outpaced their competitors, therefore, in both retention and recruitment. And this is because enabling remote work for some of the time offered their staff members, their frontline staff members, flexibility, improved their job satisfaction. It actually increased productivity and boosted recruitment. So we're clearly seeing that. People worked longer hours when they were working remotely. Very, very clearly see that. And of course, it addressed burnout issues. So nearly 20% of healthcare workers left their jobs since the pandemic began. 49% cited burnout or stress as the main cause for leaving. So it's about half. That's a huge number of people. Remote work, of course, having some time worked remotely, so hybrid modality as opposed to full-time in-office modality or in the hospital modality, reduces burnout and stress. We very clearly see that. So really, it's kind of irresponsible not to offer it to healthcare frontline staff. It's key to retaining them. It's key to addressing stress and burnout and improving their well-being. Now, I do see some biases, some bad decision-making hindering remote work adoption. I had to overcome that in the hospitals I worked with. So remote work makes sense for financial sense for companies, for healthcare organizations, for hospitals. Adopting it requires overcoming cognitive biases. And these are unconscious thought patterns, dangerous judgment errors that shape our perceptions and how we make our decisions, that lead to pretty bad consequences in the workplace. So there are two common biases I want to talk about: status quo bias and empathy gap, that pose a problem for flexible work adoption. Status quo bias, how does that apply to hospital work arrangements? Well, first of all, let's talk about what it is. It's a preference for maintaining the current state of affairs, even though there's a very strong argument to be made that a new state of affairs would be better. So that prevents hospital leaders from exploring alternative work setups that would address the administrative burden on staff and help them have more flexibility. So healthcare workers are currently spending unnecessary time commuting just to come to the hospital and do paperwork and emails, which results in burnout, decreased job satisfaction, harming retention, recruitment, and so on. Empathy gap is another cognitive bias here. So let's talk about that. Empathy gap is a difficulty in imagining and feeling another person's emotions, including actually our own emotions in the future. We have a difficulty with that. That's an empathy gap, and other people's emotions. So without understanding the difficulties that these frontline workers experience, hospital leaders don't really recognize the need for change. And remote work can reduce difficulties and can address stress and burnout for frontline healthcare workers. But this empathy gap prevents hospital leaders from seeing these benefits. So what I want to encourage you to do is elevate healthcare quality. We can elevate it by addressing these biases. The healthcare industry, of course, has a crucial role in providing good patient care. And so it's important for employers to acknowledge how their cognitive biases are negatively impacting staff, and how really overcoming these cognitive biases and adopting flexible work options can help reduce administrative burdens, where they don't have to now come to the office to do their administrative work, so they don't have to commute, and that's part of the administrative burden. Improve their job satisfaction, and mitigating biases creates more supportive work environment and improved patient care, improved patient outcomes, which is obligatory, of course, for healthcare settings. So remote work provides a competitive advantage for hospital leaders. The tight labor market makes it challenging to attract talent, and allowing remote work improves job satisfaction, productivity, ability to attract and retain talent, and reduces burnout and stress. So as remote work grows, healthcare organizations who want to stay competitive must embrace it in order to do so and reap benefits like higher retention and so on. All right, everyone. I hope you've enjoyed this episode of the Wise Decision Maker Show. Please make sure to subscribe wherever you checked out the show and leave a review. It helps others discover the show, and it helps us improve the show.